So our next speaker is a friend of mine, James Radke. I've known James for quite a while. We first met at Global Genes, right? That's a long time ago. He's also Chief Educational Director at CheckRare CE. You can go there and check out continuing education courses in lots of different rare diseases. He's president of Zeal Access, and for many years he's helped patients tell their stories. So that kind of plays into what he's going to be talking about here.
I have homework for you later, just so you know. Is it top button? Okay.
Oh, no, side to side.
Okay. And so welcome everybody. It's a pleasure to be here. Thank you for inviting me, Brad. And basically, after all that science, I just want to slow things down a bit and sort of help you explain all that science in a way that's more amenable to the people that you're talking to about Pompe disease. And that will be the homework. I'm gonna hand around things to the various tables, and you're gonna have to just sort of explain Pompe to a distant cousin, to your pulmonologist, to the PT, to the 8-year-old boy in the playground. What do you do? So that's my punishment upon you. But before you do that, you can punish me, and I will explain myself a little bit. And as you can see, there is a theme, but I like to think I'm fairly complicated, just like Pompe disease. And so I have 3 various stories here that I can briefly explain who I am. So raise your hands if you want to hear 1, 2, 3, or 4. So who wants to hear the story number 1, 2, 3, 4? Okay, it's either 3 or 4, so let's do 3 or 4 again. 3, 4. Okay, 4 wins. That one was last year. That was Pies for Pompe. I'm sure you all, and if you don't know what that is, shame on you. But Brad asked me, well, he just said jump, and I said how high? And he said, you're a medical writer. Can you explain Pompe, but at the same time raise awareness for Pompe by having somebody throw pie in your face? And I went, yes, I can do that. Can I wear my zebra costume when I do that? And he said, yes. So what I did there was I kind of explained very briefly, Pompe is a devastating disease. You don't know what's happening. Suddenly you're walking around fine, or you have a baby that looks fairly healthy, and somebody tells you have Pompe disease, and it's like getting a bucket of ice on your head or pie in the face. And as soon as I said pie in my face, my wife slapped pie in my face, and my daughter slapped pie in my face, and her fiance slapped pie in my face, and the dog was there just laughing away. And that's how I did it. It was 30 seconds. And it got pretty good views, I thought. But that sort of goes to my skill set. I'm here to help explain things as quickly as possible to raise awareness. And so that's what the homework assignment I'm now going to give to you is, how do you explain Pompe? And if you think about it, just like the theme you had before with the zebras, it was, at its core, it's pretty simple. It's just one enzyme, right? But having to explain that and the different aspects and symptoms that one enzyme breakdown causes can get complicated. And especially the severity of it, who you're talking to, their educational background or their interest or not. And so what I'm going to do is sort of break it down to you is that, first of all, when you explain Pompe, you sort of figure, well, who are you talking to? And then why are you talking to them? And sort of what is your strategy to get your story across so that they understand? And so these are some of there's 1,000 examples of how to explain this. Here's just a few. Talking to an 8-year-old child in a playground, and you have late onset Pompe disease. Assume you're an 8-year-old boy. And so how do you explain that to them? Or an adult friend, a babysitter, or the parent of a friend your child's going to spend the overnight with them. How do you explain Pompe to them that's relevant? Or, distant family relative, nurse, et cetera, gym teacher, pulmonologist. So your homework assignment, I'm going to hand out some papers later to each of the tables, and you're going to sort of do your own, but I will do the first one, and that would be the child, just the 8-year-old, think of the 8-year-old child in the playground. What are your goals in doing that explanation? It's just to make a friend. It's that simple. That's all you want to do. And you don't have to go too much into the science. You want to keep it simple and friendly. Sort of acknowledge what you can and can't do, and sort of, no, I lost that. So the example I came up with was, don't necessarily explain the pathophysiology of it. Just say, I have trouble running fast, but I can do other things. Do you know how to play Fortnite? Just change the subject very quickly, all right? And I'm not sure if Fortnite is still a thing. I'm showing my age. I think it is. I was going to go with Lego, but I use Fortnite. But with that, I am now going to have some homework assignments. I'm going to put some handouts to each of the tables. I have 6 tables, so I'm going to ask the researchers and speakers if you could join a table with a family, and I guarantee you'll learn quite a bit from them on the frustrations they have in explaining that. And I will hand out some pamphlets just sort of to say, when you're talking to an adult friend, what are the goals, what are the strategies, and maybe provide an example. And I'll give you like 5 minutes to come up with a pitch, as it were, and then we'll just get back together and we'll discuss them. So I have 6 examples. So I'm going to hand them out to the 6 tables that I know have Pompe families, and I would ask that the people who don't have Pompe to go to one of those tables and just learn from the experts, as they say. All right?
So do you want online people to just come back in 5?
One more thing. No, online people, you have homework too. Write down in your chat some of the concerns you have, the problems you have, frustrations you have with explaining Pompe to different types of audiences, and some of the challenges you have, especially for specific audiences. Or just give me your elevator pitch, if that's okay with you. All right? All right, I have the first one here, and it's the pitch to the gym teacher. And what they said was that most people with Pompe can't keep up with the average physical activity a normal kid can. And have you any suggestions on what we can add to that statement on how to help the gym teacher be more empathetic to the person with Pompe disease? Anyone? Where's the microphone? Because I think it's one thing to, tell the gym teacher that there's a concern, but there is the other aspect of getting them to understand it. And that's sort of one of the goals that we have for the pitch. Yes.
Gym teacher, one thing that they may like to know is that it causes us to have a weak core. So because they're thinking physical, right? They're a gym teacher. So understanding how it affects us physically might give them insight on what they can do with us that might be different than with the other kids or whatever.
Yeah, and another aspect would be, you can still do some activities and just want them to be, again, more empathetic to what you can and can't do, but you still want to do some exercise.
Trying to speak loud.
Actually, no. Yeah.
I think another thing that's important for gym teachers to know is that energy levels can look different, because sometimes say it's after an enzyme infusion or whatever, and they can do this day, but not do it this day. They're more fatigued or tired, but just knowing that exertion level can vary depending on the individual.
Yeah, excellent point. Anything else? Okay, I'll move on. Who had adult friend? Do you want to give your pitch?
Um, so the goals we have is physical awareness, strategies. We're to talk about just the DNA and the aspects of how it occurred to a Pompe person, to a friend. And our key points were just them realizing like a different appearance of like how we walk a little different compared to other people. So that's like one of the key points where people notice of like a question of like what's wrong or what happened to you. For example, for my friends, they would be like, "Are you okay?" or like, "Why are you limping?" And so that's just like one of the things that people do tend to notice. And so that kind of gives an open factor of like how to kind of discuss the Pompe to a friend. And sometimes us like new like my sister, she's kind of new Pompe, doesn't know how to explain that. So sometimes friends do research their own. As like my friends, they have done their research and they understand it, and then they just to understand it more better. And they every time we do like hang out, they like were more aware of like some things that we can't do, like stairs. So then they look at restaurants that like don't involve stairs and stuff like that. So, yeah.
That's an excellent point, yeah. Stairs and just long walking distances, it takes a while for people to understand that completely. But just watching a Pompe person walk is helpful. But I tell everybody I'm a recovering ableist. Means I'm an ableist at my core. I grew up just running. One of the stories that I didn't tell you, which was number 2, I think, number 1, was I met my wife and our first date was a soccer game, our third date was a 5K run, and our fourth date was a 10K run. She can't run. And it didn't occur to me till the 5th date that, oh, I get it now. So it does take time, and you probably have to repeat the explanation over and over again. Babysitter?
Yeah, we got babysitter.
Wait, we have a microphone.
I struggled, I'm not going to lie, because I'm an LOPD patient, so the whole child with the disease thing isn't really part of our reality. But I would think, the goal would be to make the babysitter comfortable, just make them aware of the fact that, the child might not be like other clients they have, and, they might not be that interested in physical play as much as other kids that they babysit. They might be more into board games, video games, watching a movie, that kind of stuff. And, just especially for younger children, I would imagine having a babysitter be more aware of potential choking hazards, things like that, when feeding the children. That's, that's what I came up with.
That's spot on. It was most to do with, what to do in a case of an emergency. But sort of reassuring them that emergency is probably not likely going to happen. But also at the same time, you want the kid to get out there and socialize. Distant family relative. Oh, sorry, go ahead.
Hi, I have a child with infantile onset Pompe disease, and if I'm going to talk to somebody about how to handle them, I just say, and it is very variable with all the children, right? My personal child has learned how to run. He learned how to run in kindergarten, and I tell people he can run, just not as fast as anybody else. He has less stamina. He maybe has a little bit less balance, but he makes up for it quite well. So just maybe be a little bit more aware, but treat him like you would anybody else, basically. Just be a little bit more aware, I guess.
Okay. Nurse, physical therapist, other healthcare professional? Pardon? Oh. Oh, sorry. All right.
So the goal I wrote is basically to keep them informed. So since they are still family, we should let them know maybe like the genetics aspect. Maybe they can get it checked out and like the general effects. And since their distance, I also wrote to keep it lighthearted. So like if they want to ask questions, they can, but we don't know why they're distant. So if
I just meant somebody who's not in your household, you know. a cousin,
I see.
something, yeah.
Yeah.
And it had to do with, you were spot on that, you know, make them aware of the genetics, but also, I find it interesting, it sort of depends on your family, but I know my family can become very overprotective, and you probably don't want that. You want to still lead a fairly normal life, but also, you know, I joked, I said, but you want to play it up a bit so you get, you know, really good birthday presents, so. Anything else to add to that for explaining to family members?
I also put in the key points that there are life changes going on. We may have more appointments. We may not be as available as we could be. Like I have a 3-year-old son and he has so many appointments. So making plans with family members, it's not exactly easy to do these days.
Good point. Yeah. All right, now, nurse, physical therapist. There we are.
Yeah, for us, for having the nurse physical therapist, the goals were just kind of passing on the simple information that we had. Kind of straightforward, simple explanation of the sugar not breaking down, having lower muscle tone, lower mobility. For us, our son, we have a team of doctors and a breakdown of our kind of an explanation. So we would always just bring a folder with us and kind of give it to any new doctors coming into the loop. I think that's all we had for ours.
I was interviewing a patient about 2 weeks ago on a different disease, and patients can notice when the doctor or nurse is come into the office, either if they know the disease or they just did a Wikipedia search 2 minutes before. And just so for the health professionals in the room, we notice. And so finally, pulmonologist, I've stuck pulmonologist in there because I just know from Brad's experience, it's a love-hate relationship with the pulmonologist. It's one of the diaphragm is one of the most important, you know, muscles for Pompe disease, and it's very important that you get that pulmonologist is as informed as they want to be and understands possibly the different physiology involved compared to other muscle disorders. So who do we have for pulmonologists? Yes.
So basically, we were kind of doing the whole, like, it's been so long since we've had to speak to a specialist, like a pulmonologist, that doesn't actually know about as much, if not more, about Pompe as we do. But so we kind of worked a little bit backwards, that we did our example first, which is the elevator pitch that we give basically any new specialist, which was Pompe disease, lysosomal storage disease, where patients have decreased or no acid glucosidase enzyme to convert glycogen back into glucose, to be used in the diaphragm muscles, accessory respiratory muscles, etc. This will lead to decreases in the PFTs, increased needs for strategies to improve breathing functions, quality of life, and the ongoing going forward strategies to delay need for BiPAP, CPAP, ventilator. So our goals were basically like, we want to make sure that the pulmonologist knows that we want to improve our PFTs. We want to have them and us better understand the medical jargon that they should understand already. So you can use those big words that you wouldn't use in most of the other categories.
Good point. And do we know if there's anything from online? We've done gym teacher, that was the first one.
Oh, yeah, yeah, right.
Yeah, we don't have any questions. We just had somebody who just wanted to sort of mention that from his perspective, he finds that people are smarter than we give them credit for, and so in some cases, obviously, like talking to an 8-year-old kid, like you don't want to use the medical jargon, but you shouldn't be afraid to really have them if they are willing to have that conversation with you, really get into it if they want to. And sometimes a distant aunt or whatever just really wants to sit down and talk to you about this for half an hour to an hour, and that it really doesn't from their perspective, it doesn't it sort of does a disservice if you sort of shy away from explaining Pompe simply out of like social norms, right? People care about you for the most part. So yeah, not being afraid to talk about it. It's a big part of your life. It can be as big or as little as you want it to be. But yeah.
All right, well put.
So I think it's really important that we actually get to deliver, it's like a pitch, right? To different audiences. I wanted to give you an example. I was at a conference, this is years ago, and it was here in Vancouver. My hotel room was in a tower, and my hotel room was way up at the top. I don't know why, but it was way up at the top. And I got on the elevator, and there was one person in the elevator with me. And it's a long trip down to the ground floor, right? And he said to me, so what are you here for? So I told him I was there for a CORD conference. So CORD is the Canadian Organization for Rare Disorders. So basically I was there for a rare disease conference. And he was like, oh, I'm Dr., I forget his name. Tell me about what you do. So when you say elevator pitch, like that's exactly what that was. So that was the time I had between about the 20th floor and I think the 3rd floor we both got off. So that's the amount I had to tell him what Pompe disease was. So sometimes you have to be really, really brief, but you can read your audience as well. And when you read your audience, they're going to ask you questions if they want to know more. So, and that's kind of awesome.